Good morning, everybody, and welcome to The Balancing Act. We are so glad you joined us this morning. I'm Julie Moran.
And I'm Olga Villaverdi. All right, busy family we have.
Oh, yeah.
Always on the go.
Yes.
No time to make a delicious meal the whole family will enjoy. Well, we've got a solution for you today.
That is so true. And then we're switching gears and bringing back an important segment on liver-directed therapy. It was nominated for a special award, and we want to share that with our viewers.
Great segment there. Plus a look at rheumatoid arthritis, or RA. And it all starts right now on The Balancing Act. It's everyday gourmet time, and with a chill in the air, there's no better time to serve up a warm, hearty meal that you can make in just minutes. Even better, this dinner time idea also offers up a way to sneak in some nutritious vegetables your kids will actually love to eat.
Everybody hungry?
Yeah! You're a busy family on the go. There's school, a job, homework, and after-school activities. There's just no time to make a hearty, delicious meal the whole family can actually enjoy. Or is there?
Let's make yakisoba noodles.
Yum!
That sounds great.
Yakisoba noodles come in 12 flavors, so no matter what you're in the mood for, there's something for everybody. Tonight, we're making macaroni and cheese with a twist. We're sneaking in some fresh herbs and vegetables. To prepare, just add water to the fill line and the flavor packet. The noodles cook right in the tray in the microwave in only 4 minutes. While the trays are cooking, steam some frozen broccoli. Allow for about ½ a cup per person. Family won't eat broccoli? How about some carrots, celery, and corn? Let's face it, everything tastes good in mac and cheese. Then finally chop some chives, about 1 tablespoon per person, and take out some shredded cheese and breadcrumbs for topping.
Dinner's almost ready.
Smells good too.
To finish your noodles, add the flavor packet and add the broccoli. Stir, top with diced chives, a little cheddar cheese, and breadcrumbs. Enjoy.
Thanks for the great meal.
And it was so easy.
Everyone loves mac and cheese, and what a great way to sneak in some vegetables too. And whatever you think your family will enjoy. Now head to Marichon.com for more great ideas, and you can find Marichon ramen noodles in the soup aisle of your local supermarket. Don't forget to check out our website. It's thebalancingact.com.
As I mentioned at the top of the show, we are re-airing an informative Telly-nominated segment.
In fact, this is a Telly, and it's given to the best of the best in the cable TV industry, and we're really very honored here because we here at O2 have been awarded a Telly many, many times before. So please watch this very special segment.
Liver cancer, it affects 1 in every 35,000 people each year. Known as hepatocellular carcinoma, or HCC, it plagues men slightly more than women, but remains a disease our next guest is determined to help conquer. Joining us to talk about novel outpatient treatments against liver cancer is Dr. Maureen Cohey, an interventional radiologist at the University of California, San Francisco. Doctor, welcome. It's so great to have you back in the studio with us.
Thank you.
You know, what do typical HCC risk factors tell us about the chances of being diagnosed with liver cancer?
So the most common risk factors include viral hepatitis, so hepatitis B and C. So if you know you have that or a loved one has that, then you can have a higher chance of being detected and you can get screening for liver cancer. Obesity, type 2 diabetes, alcohol consumption, those are also risk factors.
From a treatment perspective in terms of hope and help, what's happening now for those being diagnosed with HCC?
So the curative therapies for HCC include liver transplantation and also surgical removal of the tumor. But the problem is that not everyone diagnosed with HCC qualifies for transplant or surgery. So one great novel technology is a liver-directed therapy with radioembolization, or such as TheraSphere. And this is a liver-directed therapy where we inject these small beads that are coated with radioembolization radioactive material into the tumor, and that causes the death of the cancer cells. And so the tumor gets smaller, so the patients have more time to get a liver transplant, or the tumor gets so small that the surgeon can finally take the patient to the operating room and remove the tumor, and it will enhance their survival.
And what makes this treatment preferable? I mean, I think I know, but say that for me again.
So I think the best part about the treatment is that it's an outpatient procedure. So you go into the hospital, you get the procedure. After a brief recovery, you go home. The quality of life is maintained, so you still get to wake up at your house and run your errands. And the hope of getting additional therapy afterwards, so if you need additional local regional therapy to the liver, if you need surgery to the liver, is still available to you.
And what are the criteria for successful treatment?
Usually what happens after the procedure, about 1 month to 3 months later, patients undergo some sort of imaging, either a CAT scan or an MRI, and what we hope to see is the tumor has shrunk significantly, and also it has died, so that the patient can either go on to have other curative therapies such as liver transplantation or surgical resection.
What's the most takeaway information we can get?
Yeah, I think if you have HCC or if a loved one has HCC, it's important to know that there are a lot of different therapies out there, and novel therapies such as TheraSphere, radioembolization. So it's really important to talk to your doctor, ask them if you qualify or if you can talk to somebody that knows more about it.
Ah, such great information. Thank you so much for joining us today. And if you'd like additional information on this important medical and health topic, please visit us at thebalancingact.com or log on to Facebook/The Balancing Act fans.
TheraSphere, important safety information. Indication. TheraSphere is authorized by federal law for use as a humanitarian device in radiation treatment or as a neoadjuvant to surgery or transplantation in patients with unresectable HCC who can have placement of appropriately positioned hepatic arterial catheters. The device is also indicated for HCC patients with partial or branch portal vein thrombosis or occlusion when clinical evaluation warrants the treatment. The effectiveness of this device for this use has not been demonstrated. Adverse reactions. TheraSphere treatment has some common side effects, including mild to moderate fatigue, pain, and nausea, and may occur throughout the first week after treatment. Some patients may experience loss of appetite and temporary changes in liver blood tests. The introduction of microspheres into the vasculature of the stomach, duodenum, or other organs of the gastrointestinal tract may cause chronic pain, ulceration, and bleeding. Microsphere shunting to the lungs may cause edema and fibrosis that may not be reversible. For more details on rare or severe side effects, please refer to the TheraSphere package insert at www.therasphere.com. For more information, please refer to the package insert for TheraSphere contraindications.
Rheumatoid arthritis, also known as RA, is a debilitating and painful condition affecting women more than twice as much as men. An abnormality in the body's immune system, RA symptoms include inflammation in the lining of the joints and other internal organs. With us to discuss what's being done to help RA patients is Dr. Ara Dokranian, an MD and arthritis and rheumatism specialist with San Diego Arthritis Medical Clinic, a single specialty private practice based in Southern California. And coming up later, we'll meet a woman currently coping with RA and learn what medical science is doing to help manage her condition. Good morning, doctor. It is so great to have you here this morning.
Good morning. Pleasure to be here.
What and who is affected by RA, and what are the major symptoms?
There's about 3 million Americans that are affected by RA, and about 70% of those affected are women. And we know that RA is an autoimmune condition, which means it's a problem with the immune system that's manifest in the joints. So the first signs that someone might think they have RA can include things like joint pain and stiffness in the hands, the wrists, and the feet. And over time, this can lead on to other joints and cause loss of function or just difficulty with mobility. But because it's a systemic disease, people can also get systemic complaints like fevers, loss of appetite, weight loss sometimes, and just a general fatigue and stiffness in the morning that can last many hours.
You know, it affects women so much more. Why is that?
Yeah, we don't really know, but some of the theories are that some of the genes that make people susceptible to rheumatoid arthritis are found on X chromosomes, which women obviously have 2 copies of. And we know that there's hormonal influences such as estrogen. Pregnancy can play a role sometimes in terms of the onset or the severity of rheumatoid arthritis. And we also have to remember that conditions that are found in women more commonly, like osteoporosis and pregnancy, these play a factor when we're trying to choose medications that are appropriate for the RA patient.
As the disease progresses, do patients typically recognize ongoing symptoms as like the new normal? Is this how I have to feel?
It's actually quite motivating to see patients with challenges like pain and difficulty moving their joints and stiffness adapt and sort of find that new normal. So it's encouraging that we now have therapies to help patients with this and improve function in a lot of cases, in cases where patients have had physical impairment from their symptoms.
Why is RA worse in the morning?
It seems to follow a circadian pattern or a daily pattern. And we know that certain types of mediators of inflammation are found more commonly in the very early morning hours. And therefore, so patients trying to sort of wake up in the morning and get their day going find it pretty challenging, especially in women. Now, we have to really remember that women are trying to get ready going to work, trying to get the kids off to school sometimes, and in the early morning hours when they're having stiffness and pain, it becomes quite a challenge. So again, some of these symptoms that are more predominant in the morning have various therapies that we can offer and generally help with that stiffness and pain in the morning.
That's good to know. Doctor, we're going to take a break, but when we come back, we'll find out how patients are coping and what can be done to manage the symptoms. We'll also meet a woman with RA, and she's here to share her story, so don't go away. There's so much more coming up on The Balancing Act. We're back, and we've been talking with Dr. Ara Dekranian, an MD and arthritis and rheumatism specialist from San Diego. And joining us now, here to share some of her medical story, is Jennifer, a patient coping with rheumatoid arthritis. And welcome, Jennifer. Doctor, we're so glad that you're here with us today. And Jennifer, before I share your story, I want to turn to the doctor again, and I want to ask, Doctor, how do you really treat RA?
So RA has many different treatment options available now. We have old and new medications, targeted and general medications, all of which help to reduce the signs and symptoms of RA. And among these various options is prednisone, which is particularly useful for reducing inflammation in rheumatoid arthritis. And the particular type of prednisone that I like to use in my practice is Rheos, which is a delayed release prednisone. Rheos is it's approved to treat as an immunosuppressive or anti-inflammatory agent, and it has a broad range of indications among various disorders, including rheumatologic conditions like rheumatoid arthritis.
Jennifer, I know you were recently married. Congratulations, by the way. That's so exciting. But some things, at least in your life, socially, were being affected by your condition. Your family and your friends noticed things. Tell us what was happening with you.
So I found myself very fatigued. I was just tired all the time. And then I had this pain in my hands and fingers and wrists that would kind of come and go. And I would end up having to cancel plans with people because I was either too tired or I was in too much pain. I just didn't feel well overall.
Did any other parts of your body hurt?
Yeah, I had, depending on how bad my symptoms get, when I flare, my hands and wrists again are involved, and my feet and ankles, and at one point my knees were so swollen I couldn't even walk up a flight of stairs at home. Wow.
What are you doing currently to combat these symptoms?
So currently I have 3 medications that I take every day, one of which is Rheos. I also have a medication that I inject every couple of weeks, and then I have pain medications as I need them.
You seem so young, Doctor. Is Jennifer typical of some of your patients that you treat?
So Jennifer's actually a little bit younger than the typical patient. Usually it's middle ages is when rheumatoid arthritis has its peak prevalence. But she provides a great example of someone whose rheumatoid arthritis is relatively early in its stages and may be more amenable to various treatment options in that scenario.
Doctor, side effects to certain types of medication can be a patient-doctor issue, and talk about how that could relate to dealing with RA.
Yeah, we always have to balance the efficacy of any therapy with potential side effects, and particularly as it relates to Rheos, we have to consider that Rheos being a type of prednisone shouldn't be taken, for example, in people with allergies to prednisone. We also have to remember that Rheos can increase the susceptibility to infections, or it can worsen existing infections. It can also affect various hormones in the way the body responds to stress. It can cause eye problems such as glaucoma. It can cause slow growth in children. It can also cause fluid retention, mood and behavior changes, increased appetite and weight gain. It can also reduce the bone density, and especially in postmenopausal women, we have to be careful about that. And we also have to be careful in people with certain gastric and intestinal disorders who are at risk for perforations. So all of these need to be discussed, and the risk-benefit ratio always needs to be modified. And what we always aim to do is to reduce the dose of Rheos to as low as possible to help mitigate some of these effects. So obviously the side effects here are not a comprehensive list, and we always encourage patients to talk to their physicians or visit the Rheos website if they want a more complete list of information about safety.
Jennifer, are you seeing and feeling improvement?
Definitely. I have more energy, so my fatigue is better managed, and my morning stiffness is definitely decreased. I still have good days and bad days, so it's not, I don't think you're ever a fix-all with the RA. It's just balancing your life and the disease and going based off how you feel.
So doctor, before you leave us, any closing thoughts?
For people that suspect they might have rheumatoid arthritis but yet aren't diagnosed, important to engage with physicians in order to get a proper diagnosis. And for those who have RA, is really to understand that their symptoms can be minimized with various treatment options out there. Rheos is one of those considerations of a medicine that can be used, and patients should get in touch with their doctor to discuss those options.
Great information. Thank you so much for coming, both of you. And if you'd like to learn more about RA and medical advances, simply visit us at thebalancingact.com or share with us anything related to the topic of RA by logging on to Facebook/The Balancing Act Fans. So much good information on today's show. Be sure to check out our website, thebalancingact.com, as well. Lots there for you. Don't forget about Facebook and Twitter. Look us up. We'll see you again next time, and
Remember to find your balance.
So long, everybody.